Question period. I recognize the Leader of the Opposition.
Mr. Speaker, this increasingly tired and out-of-touch government isn't focused on what matters to Saskatchewan families. And at a time when 57% of Saskatchewan people are struggling to put food on the table, to pay the bills, this Premier brings forth a budget that includes nothing new to help with the cost of living. Mr. Speaker, not one thin dime of relief. Just today, the Doug Ford government announced that he's extending fuel tax relief to the end of the year. Now, why won't this Premier finally act, cut the gas tax, and deliver some relief to the people of Saskatchewan?
Recognize the Premier.
First point I would make, Mr. Speaker, is Ontario's debt-to-GDP ratio today is about 38.2%, 14% in the province of Saskatchewan. Mr. Speaker, second point I would make is the overall affordability matrix between cities, which is listed in pages 75 and 76 of the budget document, will show that, for example, a family of four making $75,000. Regina, Saskatchewan would rank number one when it comes to being the most affordable city to live in. Toronto would be number 9, Mr. Speaker. That's 9 out of 10. Mr. Speaker, only being usurped by Vancouver. With respect specifically...
So it's cheaper to live here.
Well, they didn't want the answer. They shouldn't ask the question, Mr. Speaker.
That's right.
With respect to the specific question, Mr. Speaker, over the last two and a half years,
Listen up.
We didn't, Doyle.
Mr. Speaker, over the last 2.5 years, the gas tax savings in Ontario have saved families about $328 over 2.5 years. That's about $128 a year, Mr. Speaker. The $400 in carbon tax savings that Saskatchewan families are going to receive annually, Mr. Speaker, far outweigh the $128 that $128 that Ontario families are receiving.
Recognize the Leader of the Opposition.
Mr. Speaker, not only is this Premier failing to deliver on cost of living, he's failing to deliver when it comes to keeping healthcare workers in the province. Now, the Premier claims to have the most ambitious health human resource plan in the country, Mr. Speaker. Mr. Speaker, they're so predictable, I even wrote the line in. As they're clapping for themselves, maybe they want to know that the numbers simply don't bear that out. Short staffing means longer waits in the ER, and it means longer waits for surgery. Now, why is this Premier making Saskatchewan people wait longer for health care because of the short staffing crisis that his government has created?
Recognize the Premier.
The members opposite to the second plank in the theme of this year's budget, Mr. Speaker. The first being classrooms, the second being care, as in healthcare, Mr. Speaker, and the third being communities. When it comes to that healthcare budget line item specifically, it's a 10.2% increase this year, Mr. Speaker. What that is ensuring is that, yes, we are continuing to build infrastructure like the Prince Albert Hospital, Mr. Speaker, like the Weyburn Hospital, like long-term care centres in communities across this province, Mr. Speaker. Building an urgent care centre just on North Albert here, another one to come in a partnership with the Takakoop Cree Nation in Saskatoon, Mr. Speaker, an urgent care centre that's going to alleviate the stresses on our emergency departments, Mr. Speaker, but also provide an access point for those that may be struggling with a mental health crisis or, unfortunately, may be living a life with addictions, Mr. Speaker. We need an access point to get to one of the beds, Mr. Speaker, the recovery beds that the Minister of Rural and Remote Health, Minister of Mental Health and Addictions has so diligently been focused on expanding to 500 across the province, Mr. Speaker, which again is part of that 10.2% lift. When it comes to the most ambitious health human resource plan in Canada, Mr. Speaker, that plan is showing results in this province. Over 1,000 Canadian nursing grads hired into our healthcare system, Mr. Speaker, serving and providing services in a community, Mr. Speaker, in this province. Over 400 Filipino grads, Mr. Speaker, 170 of them on the ground, more on their way, providing services in Saskatchewan communities, and a 23% reduction in our surgical wait time initiative.
Recognize the Leader of the Opposition.
Mr. Speaker, there is so much room between that Premier's speaking points and the reality out there for Saskatchewan people. Here are the facts. Only 14% of new pediatric specialists stayed in the province last year. Meanwhile, the wait to see a doctor at the Children's Hospital are long and growing longer. What does the Premier have to say to Saskatchewan parents who are waiting month after month with a sick child, waiting for an appointment, while 86% of new grads are leaving for other provinces?
Recognize the Premier.
I would say to those families that this is a government that is entirely committed to attracting more physicians into our healthcare system, attracting more nurses into our healthcare system, attracting more medical professionals of all disciplines into our healthcare system, Mr. Speaker, and into multiple communities across this province. Mr. Speaker, there was questions across this floor on some of the special warrants to close out last year's budget, Mr. Speaker. Well, over $200 million of those special warrants went specifically to fund the physicians' contract, Mr. Speaker, that this government had worked hard on to ensure that we are competitive with other provinces and other places around the world, Mr. Speaker, so that we can attract and retain the physicians right into our communities, Mr. Speaker. This is a far cry from what we saw under the members opposite when they had the honour of being government in this province. They had 60 medical training seats at the College of Medicine, a College of Medicine that was on probation, Mr. Speaker. Today that number is 105, I believe, Mr. Speaker, with 120 residency positions, Mr. Speaker, and over $300 million put into the infrastructure at that College of Medicine to ensure that it is no longer on probation and is turning out high-quality medical graduates, Mr. Speaker, that are serving the people of this province.
Recognize the Leader of the Opposition.
But, Mr. Speaker, 86% of those new grads in pediatrics are leaving the province. That's kind of the point. And it's not just parents of sick kids who are being failed, Mr. Speaker, by this tired and out-of-touch government. It's also the thousands of people in this province who are waiting for surgeries. We continue to have the longest waits for knee and hip surgery in the entire country. Shame. And last year, only 17% of new general surgeons stayed in the province. What does the Premier have to say to all of those out there who are waiting in pain for their surgery about the fact that 86 or 83%, Mr. Speaker, of those new grads have left the province?
Hear, hear. Recognize the Premier.
Minister of Health is, Mr. Speaker, not hugging any type of ideology when it comes to lowering our surgical wait times, to lowering our diagnostic wait times in this province, Mr. Speaker. They are looking abroad, like other provinces have, like BC and Manitoba, Mr. Speaker, if they can access some surgical capacity in other areas. And we are looking at building within, Mr. Speaker, with expanding the number of health training seats that we have in Saskatchewan, Mr. Speaker, and hiring people into our system with the most ambitious health human resource plan in the nation, Mr. Speaker, which is funded by this budget that was introduced just this past week, Mr. Speaker. I guess the question that I would have for the members opposite in today's day, with some successes coming from that health human resource plan, Mr. Speaker, with a 23% reduction in our surgical wait time, Mr. Speaker, how many physicians worked in the Jim Pattison Children's Hospital under the members opposite?
Recognize the member from Regina Walsh Acres.
Thank you, Mr. Speaker. It's good to see the Premier practicing to be the Leader of the Opposition. Mr. Speaker, this minister can't keep medical grads in this province, and he can't keep family doctors here either. Last week, we learned that since this Premier came to office 6 years ago, there are 14 fewer family doctors practicing in Saskatchewan. Hundreds of thousands of Saskatchewan people without a family doctor in this province, waiting in walk-in clinics and emergency rooms, unable to access basic care that they need and they deserve. How does this minister defend his record when so many people are going without basic health care?
Hear, hear. Recognize the Premier.
What we got is just a lesson in how the members opposite at Mr. Speaker actually read the data that comes out. Mr. Speaker, when he references physicians, and I think it's 14 fewer physicians, he's only counting fee-for-service physicians, Mr. Speaker. Right. He is not counting all of the salary-paid physicians across this province, Mr. Speaker.
NDP math.
That, Mr. Speaker, seems to be what NDP math looks like, Mr. Speaker, is that you only torque the numbers, only count a certain segment of the physicians that are working in our communities, not, Mr. Speaker, the numbers of physicians that are increasingly going to a salary model, Mr. Speaker, or as we move forward, Mr. Speaker, with a new physician contract, eventually to a blended capitation model here in the province, Mr. Speaker. So in addition to the fee-for-service physicians working in our communities, Mr. Speaker, there are a number of salaried physicians working in our communities, and there are over 250 more nurse practitioners as well, Mr. Speaker.
Recognize the member from Regina Los Acres.
Thank you, Mr. Speaker. I'm not going to take my notes from the Premier. I'm going to take them from the 200,000 people in this province who don't have access to a family doctor right now. Saskatchewan people deserve and expect health care to be there when and where they need it. People shouldn't have to drive for hours to receive basic care, and they shouldn't have to sit in the emergency room for hours either. Yet this tired and out-of-touch government has lost more than one doctor per year, every year, from rural Saskatchewan. 8 fewer family doctors providing basic care for rural people. Why? Why are there fewer rural family doctors providing health care today than there were when Brad Wall was Premier?
Recognize the Premier.
Appreciate, Mr. Speaker, the lesson on rural Saskatchewan residents driving hours to access their health care, Mr. Speaker, largely due to the closure of 52 hospitals by the member's office.
Nice.
Mr. Speaker, I would encourage that member to tap the member in front of him on the shoulder, the member from Rosemont, and ask him what he thinks about health care policy moving forward, Mr. Speaker. An avid supporter of the Fike Report, Mr. Speaker. The Fike Report called for, in addition to those 52 hospitals that they close another 50, Mr. Speaker. That was the Fike Report. That was the member from Rosemont, Mr. Speaker. That was his comments in May 25th of 2016. Can tap the member from Regina University on the shoulder and ask her what she thinks about Stephen Lewis's policy, Mr. Speaker, where he said, this government in Saskatchewan desperately needs to listen to renowned health policy analyst Stephen Lewis when he says if the rural healthcare system was redesigned to have health care be consolidated even into fewer centres, Mr. Speaker. So the fact of the matter is, Mr. Speaker, under the NDP, rural Saskatchewan residents are going to drive farther for their health care. Thankfully, under this government, Mr. Speaker, we have the most ambitious health human resource plan in the nation of Canada, Mr. Speaker, and that just simply isn't going to be the case.
Recognize the member from Regina Los Acres.
Thank you, Mr. Speaker. The Premier remembers that he's been in government for 17 years, right? And under this Premier's watch, there's been 53 hospital closures around this province. Now, this tired and out-of-touch government is failing to recruit new doctors, and they're failing to retain the doctors that we currently have. In 2022 alone, Saskatchewan lost 69 doctors to other provinces and only brought in 34. That's a net loss of 35 doctors in just 2022 alone. To the Minister, how many physicians have left this province due to this Premier's mismanagement?
Recognize the Minister of Health.
Thank you, Mr. Speaker. And further to what the Premier has said already, the government's track record when it comes to recruiting and retaining doctors is one that is very solid, Mr. Speaker. Since 2007, you've heard us talk about over 1,000 more physicians in this province prior to 2007, Mr. Speaker. In the past 28 months, 107 family physicians and 155 specialists have been recruited to our province for a total of 262 physicians. In just the past 6 months alone, Mr. Speaker, 24 family physicians and 29 specialists have been recruited to Saskatchewan. It includes 11 physicians from outside of the country, Mr. Speaker. In addition to that, the new contract with the Saskatchewan Medical Association will go a long way towards retention of doctors and bringing even more doctors into our hospitals and healthcare facilities in this province, Mr. Speaker.
Recognize the member from Saskatoon Eastview.
Thank you, Mr. Speaker. The behaviour of that education minister has destroyed all good faith the teachers had in this tired and out-of-touch government. Now he's backing up his latest offer with a pinky swear, and he wonders why teachers won't believe him. When good faith negotiation is gone, binding arbitration is the only option. Why won't the minister get out of the way and commit to binding arbitration so teachers can get a deal that they can trust?
Yeah.
Recognize the Minister of Education.
Mr. Speaker, I've been clear on this floor and out in the rotunda and other appearances as well, Mr. Speaker, that binding arbitration is not a reasonable option in terms of where we're at with negotiations with the Saskatchewan Teachers Federation leadership at this time, Mr. Speaker. Mr. Speaker, the STF leadership have only been at the bargaining table for half an hour in the last 5 months, Mr. Speaker. Mr. Speaker, I think people around the province, teachers included, should be embarrassed at that level of effort from their leaders, from their union leadership, Mr. Speaker. But, Mr. Speaker, you know what the people of this province can trust on, Mr. Speaker? The students and teachers and parents around this province, Mr. Speaker, is a record increase to school operating funding, Mr. Speaker. 9 new schools announced last week in the budget, Mr. Speaker. 2 major renovations, a couple of new minor capital projects. This is a government that has invested into education and is going to continue to do so.
Recognize the member from Saskatoon Eastview.
Mr. Speaker, even if the minister had behaved appropriately, his party's record would speak for itself. That Sask party government loves to promise big education spending, but only in election years. And then the year after that, they love to slash that spending down to the bone. They did it in 2012, 2017, and 2021. How can teachers give students the support they need when they don't even know what kind of funding they'll actually end up with?
Recognize the Minister of Education.
Well, thank you, Mr. Speaker. Mr. Speaker, it seems we found another member on that side who needs a history lesson, Mr. Speaker. Yeah. Mr. Speaker, if that member wants to talk about his party's record on education, that is a party, the NDP party, that shut down 176 schools while they were in government, had no PMR funding, Mr. Speaker, while they were in government, Mr. Speaker. That isn't investing in education. That is letting education in rural Saskatchewan especially decay, Mr. Speaker. Mr. Speaker, in terms of how classroom supports funding will be for the next number of years, our government was proud to sign a multi-year funding agreement with the Saskatchewan School Boards Association, endorsed by all 27 school boards, Mr. Speaker, to set classroom supports funding at a minimum floor over the next 4 years, Mr. Speaker. That shows this government's commitment to funding education into the future.
Recognize the member from Saskatoon Eastview.
Mr. Speaker, I won't be taking any history lessons from a minister who's never spent a day in a Saskatchewan classroom. Teachers, parents and students know that this tired and out-of-touch government isn't investing in public education. In 2015-2016, Saskatchewan was first in Canada in per-student funding. With this latest budget, we're dead last. Now, that minister is going to talk about per capita funding, which is just more classic Sask party math. But here's the reality. His government is investing the least in students of any province in Canada. Will the minister stand and apologize to the students that he's failing today?
Recognize the Minister of Education.
Thank you, Mr. Speaker. Well, yes, actually, the member is right. I will talk about per capita funding, Mr. Speaker, and how in Saskatchewan we have led the nation for numerous years in terms of how we invest per capita into K-12 education in this province, Mr. Speaker. Mr. Speaker, that means your family, my family, their family, Mr. Speaker. A higher proportion of our provincial tax dollars go into the education system than anywhere else in the country, Mr. Speaker. Mr. Speaker, that is a sign that this government is investing in education and preparing for the future, Mr. Speaker. Mr. Speaker, I'd highlight again 9 new schools announced, Mr. Speaker, in last week's budget, Mr. Speaker, 4 in Regina, 4 in Saskatoon, Mr. Speaker. That is a government that's responding to a growing province, and we can build these schools because we have a growing economy, Mr. Speaker.
Recognize the member from Regina Coronation Park.
Thank you, Mr. Speaker. Earlier this year, the Sask Party government closed down the Hard to Fill Skill program. This program made it easy for workers and businesses in certain sectors to access the SNP. The Sask Party government closed the program, giving workers and businesses only 10 days to complete their approvals. Why did the Sask Party government close this program and make it harder for people to become permanent resident?
Recognize Minister of Trade and Export Development.
Thank you very much, Mr. Speaker, and appreciate the question from the member opposite. This government is very proud of its record on immigration. This government has increased the size of the provincial nominee program by orders of magnitude from where it had been under the NDP, when it was literally in the hundreds. This year, it's 7,500 people, Mr. Speaker. We've worked hard to make sure that program is responsive. We work with newcomer communities. We work with business community to make sure that the streams are appropriate and responsive to what the labour market needs are within the province. This was a temporary program, Mr. Speaker, the particular one that was referenced. It was rolled out and announced as a temporary program with a limited number of nominations that would be available. That cap was reached, and that program, those numbers will be reallocated through other streams, Mr. Speaker.
Hear, hear.
Recognize the member from Regina Coronation Park.
Thank you, Mr. Speaker. Umar Khayyam is a lawyer in Saskatchewan who practices immigration law. He told CBC that he hears from people every day about this change. Quote, "It's sloppy, it's irresponsible the way they have done it. It is really sending a bad message. It shows that the government really don't care for foreign workers." Mr. Speaker, under this Premier's watch, we only have 58% of newcomers staying in Saskatchewan after 5 years. Why this government pausing this policy? Why are they making harder to stay in Saskatchewan?
Recognize the Minister of Trade and Export Development.
Well, I can tell you, Mr. Speaker, and I think the House is well aware, that we take the protection of newcomers to this province extremely seriously. That's why we were the first province to introduce legislation for the protection of workers who were located here in Saskatchewan. And it's as well why, Mr. Speaker, in just a couple of days, we're going to be introducing a new Immigration Services Act that will be the most assertive statute in the entire country in protecting newcomers to this province. And we've done that, Mr. Speaker, working with newcomer communities, working with our business community, making sure that we have the best system in the entire country. And I think, in a lot of ways, Mr. Speaker, we very much do. We're not going to rest on our laurels. We're going to make it even better. And we've expanded it markedly, Mr. Speaker, over the years as well to make sure that our economy and our labour market are able to reflect the skills that are necessary through our immigration program. That work's going to continue as we go forward, Mr. Speaker, including with the new Immigration Services Act.
Recognize a member from Regina Coronation Park.
Thank you, Mr. Speaker. This decision will result in people leaving the province. We need to be growing our economy and growing our population. This change does the exact opposite. So, Rosemary's auntie, living in Saskatchewan, after 5 years of living in Canada, she told CBC that these changes will force her out of country. There are many people in the same situation. Why is the Sask Party government making it harder for people to stay here in Saskatchewan?
Recognize the Minister of Trade and Export Development.
Well, Mr. Speaker, that's clearly not accurate. What I can tell you about, though, Mr. Speaker, is how we have worked hard on our international recruitment initiatives. 470 Filipino nurses will be relocating to Saskatchewan to work in our medical system, Mr. Speaker. In addition to that, we have worked with our regulators through our Credential Recognition Service to go from a 2-year bridging program to 14 weeks, Mr. Speaker, leading the country. And that's something that we want to see continued. That's why right now we are running advertisements, people might have seen them, inviting newcomers with skills that have been obtained from outside of Canada or from outside of Saskatchewan to contact us. We want to work directly with those newcomers to make sure that their credential is recognized, and we're going to work with regulators as well to make sure that credentials that are earned elsewhere are going to be recognized, Mr. Speaker. Leading the country in this work. Leading the country in this work, Mr. Speaker, because it is vitally, vitally important. What we're also doing is directly recruiting on the ground, Mr. Speaker, in countries like the Philippines, which...
I I recognize the member from Regina University.
Thank you very much, Mr. Speaker. Since that Premier took office, 1,999 families have lost a loved one to overdose. Nearly 2,000 people, Mr. Speaker. That's like the town of Biggar gone. And year after year, more people are lost to overdose than the year prior. And what is this government doing? Well, Mr. Speaker, what they're doing is worse than the status quo. They're choosing to cut supports that save lives. When will the minister do the work and bring forward an evidence-based plan to save Saskatchewan lives?
Recognize the minister responsible for mental health and addictions.
Thank you, Mr. Speaker. Mr. Speaker, we know that the best way to prevent overdoses is to help individuals overcome their addictions, Mr. Speaker, and that's why we've introduced a mental health and addictions action plan that does precisely that. We are focused on treatment and recovery with that action plan, Mr. Speaker. We are making it easier for individuals to reach addictions treatment spaces. We are making more addiction treatment spaces around the province. And, Mr. Speaker, we are wrapping supports around those individuals, providing them with the individualized care that they need through the recovery-oriented system of care. Thank you, Mr. Speaker.